Did you know that the choice of surgical treatment for breast cancer can have an impact on cure rates? If you have already viewed our first video, you will know that in this series by Just Medicine, we aim to review the evidence comparing the outcomes of bilateral or double mastectomy with unilateral or single-side mastectomy and breast conservation treatment, or BCT. We'll present the data showing which option allows women to live longer and live more. In this, which is the second of 3 videos, we will discuss complication rates associated with the main 3 options for breast cancer surgery. You may also wish to watch our first video on the secret of survival outcomes with double mastectomy. Please note that this is solely an educational video and is not intended to replace a surgical consultation. Do see your doctor to review your specific circumstances and for treatment planning. As we present the evidence, please feel free to pause the video if you wish to take notes or verify the information discussed. Various stages of the treatment journey has implications for survival, including the immediate post-operative period covering 30 days after the operation. The risks of complications of the 3 categories of operations, breast conservation treatment, or BCT, unilateral, single-sided, and bilateral, or double mastectomy, and their impact on survival will now be discussed by Dr. Tan.
Thank you for joining us in this second video. In our previous video, we have already mentioned that since there is no evidence demonstrating a difference in survival outcomes for bilateral mastectomy and BCT, experts recommend ipsilateral breast-conserving therapy for patients eligible for conservation. As mentioned earlier in this video, we will discuss the surgical complication rates reported in medical literature for bilateral mastectomy, unilateral mastectomy, and breast conservation treatment. I was unable to identify any research article which directly compared all 3 operations. Hence, I would be presenting the data which compares 2 out of the 3 types of operations, and then, as a trained surgeon myself, integrate the data to give an opinion about the relative complication rates. The first study I would like to highlight is this one led by a group of plastic surgeons. This is significant because by reporting this data, they potentially risk reducing their surgical workload and therefore remuneration. I can only conclude from this study that these doctors have more interest in helping their patients choose an operation which minimizes the risk of complications than making more money. And that is a highly respectable objective. The researchers obtained information from the National Surgical Quality Improvement Program database and identified 56,905 patients who underwent mastectomy from 2005 to 2012. It was noted that among this large number of patients across the country, that complication rates were higher for women who underwent bilateral or double mastectomy compared with unilateral or single-sided mastectomy. It was also higher for those who underwent immediate breast reconstruction compared with those who had mastectomy only. This is another study using information from the National Surgical Quality Improvement Program database. This team of researchers led by Dr. Chatterjee analyzed the complication rates for patients who underwent breast conservation surgery, BCS, or simple mastectomy from 2009 to 2012. BCS was also referred to as lumpectomy and partial mastectomy in this article. Mastectomy was referred to as simple to differentiate it from its predecessor operation, which was termed as radical mastectomy. During a simple mastectomy, the chest muscles were preserved as opposed to a radical procedure which removed muscles as well. For this study, the researchers analyzed the data for those who had simple mastectomy alone and excluded women who had concurrent operations like reconstruction. This is the table presenting the post-operative outcomes for women who underwent breast conservation surgery or partial mastectomy, and those who had a simple mastectomy, which is referred to as SM in this chart. Both these groups of patients also had SLNB or sentinel lymph node biopsy as part of their breast cancer operation. We can see that the overall complication rate for patients with BCS was 1.74%. In comparison, the complication rate for mastectomy was 4.04%. Further analysis found that women with mastectomy were 2.4 times more likely to experience complications within 30 days from the time of operation than women with BCS. This was statistically significant. Registry-based studies help doctors look at outcome data for large groups of patients and across broad geographical regions. This is useful so that the information is not limited to a specific institution or a particular area where the surgical practice is similar. It also provides real-world information on treatment outcomes rather than results within the confines of a randomized trial. Here we see another study looking at breast conservation surgery and mastectomy with implant reconstruction. 11,645 patients were evaluated, of whom 9,571 had BCS and 2,074 had mastectomy with implant reconstruction. The researchers found that women who had BCS with SLNB had a post-operative complication rate of 2.1%, while those with mastectomy, implant reconstruction, and SLNB had a complication rate of 5.5%. The latter group of patients was 2.8 times more likely to experience complications. We will now look at results from another country and another geographical region. These researchers from Sweden looked at post-operative outcomes from a slightly different perspective. They investigated the impact of surgical complications for older women and looked at whether post-operative events had an impact on survival. These two charts are excerpts from the Swedish study and are survival curves. The y-axis represents the proportion of women alive, while the x-axis indicates the time that has elapsed from the point of diagnosis in years. It is expected that the curves would gently slope down as time increases. When two curves are drawn on the same chart, we are better able to see the differences in survival. These survival curves compare the outcomes for women in the 50 to 69 age group. For patients who underwent mastectomy and had post-operative complications, survival was significantly poorer than women with mastectomy, but did not have any complications. In comparison, there was no difference in overall survival for women who underwent breast conservation treatment, regardless of whether they had post-operative complications. The conclusion from this study was that mastectomy significantly increased the risk of both major surgical and major medical post-operative complications. This is consistent with the registry-based studies from North America. However, this study added to the information we already know from the previous studies in that post-operative complications was shown to have an impact on survival if the patient underwent mastectomy. However, there did not appear to be a similar effect if she had undergone breast conservation treatment. As mentioned earlier, we will consolidate and integrate the data presented in the large registry-based studies discussed in this video. The consistent findings across North America and Europe are that mastectomy is associated with higher surgical complication rates than breast conservation surgery. Higher surgical complication rates with mastectomy has been shown to be associated with poorer survival outcomes. This effect on long-term survival is not seen in women who undergo BCT. In summary, breast conservation treatment, or BCT, is associated with a lower risk of surgical complications than mastectomy, whether unilateral or bilateral. Should a patient experience post-operative surgical complications with BCT, it is unlikely that her survival will be compromised. In contrast, a patient who undergoes mastectomy is at higher risk of complications, and should she experience adverse outcomes in the post-operative period, there may be an impact on her long-term survival, particularly if she is in the 50 to 69-year age group or over 80 years old. We hope that the scientific data presented here will help women with breast cancer have clarity about the choice of surgical treatment that enables her to live longer and live more. I look forward to sharing with you the data on the quality of life after breast cancer treatment in the next video. Let's chat again soon.
Thank you for completing this video. We hope that by unlocking the secrets of the scientific evidence for surgical complications, we have given our listeners confidence to make the right decision for themselves. Please feel free to email us or submit a request through our website if you have any questions. Also, don't forget to subscribe to our channel so that you will be notified whenever a new video compilation is uploaded. Stay tuned for our next video in this series. Thanks, and see you again soon.